This is Erik Dalton at the Freedom from Pain Institute, and today I want to talk about rotator cuff problems, particularly what we call impingement syndrome. My orthopedic surgeons tell me that about 80% of the people that come into your practice with a shoulder problem are suffering from supraspinatus tendinosis, or impingement of the rotator cuff muscle, superior rotator cuff muscle. It grows out of this supraspinous fossa, has to dive under the acromion here and attach to the greater tubercle. And of course, when the arm is elevated, sometimes it gets pinched. So that is the problem. And typically, as a manual massage therapist, we get in here and start immediately trying to friction this thing, stretch it, doing all sorts of stuff. And I'm going to try to talk you out of doing that today. So to begin, we just need to remember that as these scapular elevators, the upper traps, levator scapula, etc., upper part of the serratus anterior, elevate this scapula and clavicle, the medial head should drop down. So as the clavicle comes up, this part of the clavicle comes up, this part should drop down. So we're going to be testing by putting our fingers on the top of the sternal heads of the medial clavicle here and having them either shoulder shrug and watching to see which side does not drop down, and elevation of the arm, abduction of the arm. As the arm comes up, everything should move up. The scapula should be moving up, clavicle should be moving up, this should be dropping down. The other motion is not quite as important for rotator cuff, but it's important for to keep this thing mobile and to keep the mechanoreceptors from causing reciprocal muscle spasm. Guarding in the chest wall can tighten up the pecs, causing that sort of dragging down of the chest wall. It can cause latissimus dorsi to internally rotate, spasm and internally rotate the shoulder girdle, which puts it in an odd position there, right? And so as the client pushes the arms forward, this thing should drop back. So those are really the two motions. We're going to check for shoulder shrugging, we're going to check for arm abduction, we're going to check for protraction. Those are the main three. Okay, we've got Keith on the table here, and we're going to look at the sternoclavicular joint. Remember the motions at the sternoclavicular joint that we are going to test. Basically, protraction, when the shoulder comes up, the medial heads of the clavicle should do what? Drop back. And when he goes into arm abduction at 90 degrees, the medial head of the clavicle, the sternal head of the clavicle, should drop down. So one should drop back, the other should drop down. What about shoulder shrugging? So same thing with shoulder shrugging. If I put my hands on the sternal heads here, right at the top, I'm right on top without pushing on the subclavian or carotid arteries. I'm on both sides, and I'm going to ask him to shrug his shoulders, and you see if you can tell if one's not dropping down. And you can do a simple treatment just coming out to the side. As I bring the arm into abduction, right at 90 degrees, it should drop down. This is one way to do it, but if it's really fixated, then this doesn't work. So I'm just going to bring it out using my body. Notice how I'm stepping with my weight. I'm not pushing his arm. Okay, so I'm stepping and I'm just kind of dragging with soft finger pads, dragging that sternal head of the clavicle down. I've got his arm pinned like this between my body so I can do this. Okay, well, I've got to bring him into this, right? Because I'm bringing him out and I want this clavicle to drop down, right? So first I'm going to have it drop down. To do that, I'm going to take the thenar eminence of my hand, I'm going to put it right on that medial clavicular head. And I'm going to get my body so that I'm just moving my body. I'm using my body, I'm not muscling him around, I'm not using a lot of my energy. Thenar eminence goes right on that head, and then I bring him to his first restrictive barrier of abduction, and I'm going to ask him to push his arm down toward his leg. 2, 3, 4, 5, and I bring it into a little bit more abduction. It's this motion here. So now I've got him like this. So now I'm just bringing him into protraction, pulling the arm up like that. And I'm just going to brace now. Instead of being on the superior, I'm going to be on the anterior border. And then I'm just going to come up like this. Right like that. Now pull down on me. 2, 3, 4, 5, and relax. And I just bring him up like that. This works good too. Okay, so that's sternoclavicular. Got to do those.